Welcome. To determine the difference between a true radiculopathy coming from the spine where the nerve is coming out of versus nerves coming from the periphery outside, as we say in thoracic outlet syndrome, potentially from the scalenus muscles, from the first rib, from the pec muscle. When people experience tingling, numbness, cramping, the key way to really understand where it's stemming from or where it's not coming from is this little trick right here. If his head is in a neutral position and not moving, and I take his shoulder, and if I take his arm back here and I move it down, or move it up, or move it back, or move it in a position, and he starts to experience tingling or numbness into the shoulder, down the arm or hand, then we know it's a peripheral problem coming outside the spine. If we take his head and lean it over to the side where his shoulder is not moving, or move it back, or push it down, or put it in a position where we rotate it and he feels tingling or sensation moving into the shoulder and down the hand or the fingers, then we know it's coming from the neck region. The nerves that come off the mid-neck area, you can see how it goes from the neck down the arm into the hand. The issue here is to determine that if this nerve is being affected from where that nerve is coming out between the vertebrae, that is a radiculopathy, particularly that you're getting symptoms into the shoulder, arm, hand, fingers, tingling, numbness, cramping. But if we keep that head still and we move that shoulder around and the nerves become entrapped either in the muscle, particularly in the scalenus, in the pec area, the pec minor, or actually in the first rib, those three areas in thoracic outlet syndrome, or other areas, particularly in the muscles itself, because as the muscles contract, if you have a stiff neck or your neck is turned a certain way, you can inflame those nerves. Those nerves and the arteries run right through those muscles. That's what's really important, is that you understand the source of where it's stemming from, so there is no guesswork. The key point in this video is that you understand to be a better diagnostician for your own particular body, knowing where the source is stemming from. I do recommend that you follow up with a professional, a therapist or a doctor, to get an accurate diagnosis. But this is important to realize, because when we diagnose the spine, particularly with spinal nerves coming from disc herniations, bulging disc, or anything peripheral where it's getting contracted or pinched on from a contracted muscle, that is a very important thing to understand. Leave your questions below. Subscribe, and most important, make it a great day. I'm Dr. Alan Mandell.